Morning, everyone. So this is our next panel. Welcome to our panel discussion on suicide prevention and postvention. Suicide is a difficult topic to address, and it's not something that is often publicly discussed. Things are changing, of course, with an increasing number of high-profile individuals openly talking about their own past attempts, and with an increasing amount of coverage and attention in the media. Just in the last few months, if you've been paying attention to the news, there have been a number of articles talking about student suicide in the Toronto Star, CBC, and then there's the very controversial 13 Reasons Why. So we're talking about it. We're starting to talk about it. And we wanted to bring that conversation here today. To think about it in terms of how we can build safer campus environments. And when I say safer, I don't just mean it in terms of institutional protocols and policies that discourage suicide attempts. Safer campus environments refer to fostering the type of campus culture where students, staff, faculty, everyone feels like they can talk about their feelings of struggling and feels like they will be supported by their campus. So without further ado, I will introduce the members of our panel today. We have Cheyenne Yazdapana, who is an engineering student at Ryerson University. Cheyenne is a speaker with Jack.org, doing his part to ensure that everyone prioritizes their mental health and takes action to end the long-standing silence surrounding it. And next is Melinda Scott, who is the Dean of Students at University College at the University of Toronto, where she's responsible for overseeing student success initiatives and the co-curricular student experience. She has more than 15 years of experience working professionally in the field of student affairs and services. Andrea Carter is the Assistant Dean of Student Wellness, Support, and Success at the University of Toronto, Mississauga. She oversees health and counseling services, accessibility services, and physical health, recreation and athletics for the campus. As a member of the campus seniors executive team for crisis management and critical incidents, she brings a wealth of knowledge in areas of mental health, suicide, violence, threat, and risk assessment. Alison Burnett is the Director of Student Wellness at the University of Guelph. She oversees health, counseling, and accessibility services, health education and promotion, and the Health and Performance Center. And Meredith Gardner is the Director of Services at CMHA Waterloo Wellington. She oversees many of the mental health programs and services offered at CMHA Waterloo Wellington. And finally, and most importantly, Sophie Halpert, the Executive Director at the Ontario Undergraduate Student Alliance, which is an advocacy group that represents undergraduate students in Ontario to the provincial government. Sophie is the moderator of the panel today, and I'm going to hand it over to her.
Great, thank you. Great. Well, thank you everyone for being here today. I just want to start out by saying that I'm delighted to be surrounded by, as Perlin might say, much more important people than myself, who really are experts in this area and hopefully will share a lot of great messaging to help everyone in this room deal with this increasingly difficult problem on campus. I apologize to everyone on this side of the room. I didn't want to stand to further block the panel, so if you can kind of see me through this clear mic stand over here, hopefully you can still interact with us. We're going to start out by allowing everyone just a chance to introduce themselves in their own words and talk about why they are here today contributing. Oh, perfect. This is great. Oh, great. Awesome. So they're going to introduce themselves and why they're here contributing to the panel. Then we do have some questions about prevention, postvention, and collaboration that we're going to try and get through. But I encourage you at any point in time, just put your hand up, and we really want to make this a panel with audience interaction to get to the questions that are really at the core of what you're experiencing on campus. So with that, I'll let Cheyenne start us off.
Sure. So hi everyone. First off, thank you for having me here today. I know that students are always, happy to be part of the conversation, but especially in this room, I think it's a really important thing, and I'm so honored to actually be here with all of you here today. So a little bit about myself. I'm actually a student at Ryerson, which is just on the street from where we are right now. I'm a fourth-year engineering student. Other than what I do at school, I volunteer with an organization called Jack.org, which some of you may have heard of, which is a youth mental health advocacy group. They're an organization, a charity that works all across Canada, where they empower 2,500 students to essentially do different things in their community to end the silence and the stigma surrounding mental health. And they do this through a lot of different ways. And like most of the students in that huge network, a lot of us got involved because we all struggled with our own mental health at some point and realized there needed to be a change. And so for me, I struggled a lot with my mental health during my transition from high school to post-secondary, which I'm sure a lot of you know can be a very tough time for students. And during that time, I was what I would call the kind of classic student who didn't know anything about mental health, how to take care of their mental health, let alone that they even had mental health or what that even meant. And so obviously with all those things, I started struggling a lot. And unfortunately at the same time, I was dealing with a lot of family issues, which really made it where I couldn't really take care of my mental health. And when I got to university at Ryerson, I didn't really do anything to kind of improve the situation. And it got to a point where a lot of things were getting really negatively impacted by what I was going through. And it wasn't until one of my friends reached out to me from high school who just kind of started talking to me very openly and kind of really randomly about small things. And then we started talking more and more, and as we started talking more, I started opening up about things I was going through, and she started opening up about things she was going through. And through this very simple conversation, I learned something, which was that students, youth, all of us kind of struggle with things, and oftentimes we're not alone in things that we think we're really alone with. All the things I was kind of going through, I thought I was the only one dealing with them, and that made it really hard to open up about it. But when I learned that she was going through things, other of her friends were going through things, I learned that I can be open about these things and ultimately get help for it. So I did get help. I went to counseling. I opened up to my family, my friends, and I learned that I do need to be part of some kind of movement that changes this so other students aren't impacted negatively the same way I was. And so then I heard about Jack.org and what they do, and so I joined them in my first year. Right now I'm in my fourth year. And what I do with Jack.org is I'm a Jack Talk speaker. So it's one of their programs where I go to different high schools and universities just within Toronto, Ontario, and I give these talks surrounding mental health and what it kind of means to have mental health, really the basics, how to take care of yourself, how to take care of others, in regards to their mental health. And through this, we hope to eventually, create the generation that ends the stigma and where mental health isn't something which is so obscure to us as it was for me. And other than that, I just try to do what I can on campus and with my friends. So yeah, that's why I'm here today. Thank you.
Great. Thank you, Cheyenne. Melinda, I'll pass it over to you.
Thank you so much, Cheyenne and Sophie. Good morning, everyone. It's a pleasure to be here this morning. My name is Melinda Scott. I'm the Dean of Students at University College in the University of Toronto. And I know some folks may be very familiar with the organizational structure at U of T. For other folks, it's a bit of a mystery. For some of us who work there, it's still a bit of a mystery. But essentially, the Faculty of Arts and Science at U of T is divided into 7 undergraduate colleges, really in an effort to make what is a very large faculty a little bit more of a manageable place for students to find community. So University College is really quite similar to a small undergraduate university in the heart of what is a very large research institution. So it's been my pleasure to be the Dean of Students there for the past 6 years, and essentially my role is really around facilitating the co-curricular life of the college. So that's overseeing things like the student residences, the commuter student center, student success initiatives, whether that's personal or academic support, student life programming, so things like orientation, mentorship, leadership, and of course supporting students in distress and managing situations, high-risk situations that may be connected to the college. So the lens that I'm bringing to this panel discussion today is that of an administrator, and specifically a student affairs administrator. I'm not a counselor. I don't direct a health center or a counseling center, but I think from my own experience and from the conversations that we had yesterday, and we've even already had this morning when we're thinking about the Okanagan Charter, we know that student mental health impacts far and wide across the campus, and in return, the campus far beyond the counseling center can impact student mental health. And so when we're thinking about that from a suicide prevention perspective, for me that's thinking about the really critical roles that students, staff, and faculty can play in creating a supportive campus community, in reducing stigma across the campus, and even in identifying and assisting students who may be at risk of suicide. And from a postvention perspective, again, I think probably lots of folks in this room know that very sadly the death of a student can reverberate far and wide across a campus. It impacts, again, students, staff, and faculty, and in that postvention process, there's often follow-up and impact that, again, is outside of the role of just of a counseling center and where administrative units across the campus have really important and really critical roles to play in that postvention process. Probably, again, like many folks in this room, and I know most certainly other folks on this panel, I have had, unfortunately, the experience of having to respond to the death of a student by suicide on campus. In particular, at University College, we had about an 18-month period of time where within our residence environment, we had 3 students who did die as a result of suicide. And 2 of those incidents happened physically inside our residence environment. And so in responding to those really challenging situations, I think it's a place where Andrea, who's going to be introducing herself just next, and I really engaged in some conversation and some planning around what are the protocols that are in place, not just at our college, but institutionally. What are the supports that are available for other areas of our institution and other institutions more broadly who may be experiencing similar situations, and how can we share the learning that we have gained with others. And so we have presented on this topic at the caucus conference back in June and at the NASPA Mental Health Conference in January, and I think we're somewhat overwhelmed by the interest in this topic, and it really shows that it's something that many campuses are dealing with, and it's something that can be very challenging to discuss openly. So I think I'm hoping that we can share some of what we've learned from these experiences, and I hope that we can engage in a really, really interesting conversation today with the panel and with all of you.
Great, thank you, Melinda.
Good morning, my name is Andrea Carter, and I am the Assistant Dean for Student Wellness Support and Success at the University of Toronto Mississauga campus. So it's just to add another layer of confusion to the U of T structure. In addition to the colleges, we also have 3 campuses. So we have the St. George campus, which is the downtown campus, Scarborough, and Mississauga. On the Mississauga campus, we are about 15,000 students in terms of the students that we support on our campus. And we also are a member of the Faculty of Arts and Science. We also have graduate students on our campus and students who are completing research-intensive programs as well in terms of the interests that we help to support. In my portfolio, we've recently brought together some services that were independent and somewhat siloed in the nature of their work. So we've brought under a student wellness umbrella the Health and Counseling Center, accessibility services, which accommodates our students with disabilities, and also the physical education, athletics, and recreations department. So all of our athletes, recreation, and sports activity. And what we're doing in terms of partnerships and pilot projects are trying to find ways in which these services can support one another, can support the whole student as they move through their experience in their undergraduate career, and look for unique ways in which we can support some of the strains and challenges that might be on some of these services. So for example, when a student is waiting for counseling to start up in terms of personal counseling and might find themselves on a bit of a wait list, we're starting to partner those students with our Recreation, Athletic, and Wellness Center so that they're teaming up with personal trainers and they're receiving some new information about how to manage depression and anxiety symptoms while they're waiting for their counseling spot to open up. Previous to this role, I was the Director of High Risk at the University of Toronto and helped to manage critical incidents and crises on all 3 campuses, focusing on staff, faculty, and student incidents and issues that did arise. That is when, similar to Melinda's experience, I worked on some critical incidents that involved suicide of students. And we partnered up after a couple of our incidents that I think were very impactful, where we started to look at what the conversation was like on campus that moved beyond that prevention conversation, but the reality of what the campus experience is or the institution experience is after a student dies by suicide. So I think all of us who are with institutions will say that we have a critical incident or crisis plan. We all have that binder that has procedures in it, but when it actually happens in practice, sometimes that binder either isn't useful, can't be found, or has never been read. And Melinda and I really looked at what does that mean when you're dealing with these incidents, what does it mean from a staff and faculty perspective, and what is the impact from a student perspective as well. So The lens that I'm bringing to this conversation is also one of an administrator, but one who I think with my amazing colleagues have been able to look more closely at the reality of these situations, to find ways in which we can be more supportive in these situations, and also very realistic in the things that you need to consider and think about when these incidents do happen on campus.
Thank you. Allison, we'll pass it to you.
Thank you. Is this on? Yes. Thank you very much, Sophie. As I was introduced, I'm Allison Burnett. I'm the Director of Student Wellness at the University of Guelph. For those of you that don't know Guelph, it's a city of about 131,000 people located just west of the GTA, about 45 minutes. We have a student population of about 23,000 students, both undergraduate and graduate. And we are a residentially intensive university in which over 80% of first-year students live in our residences. Last year, the University of Guelph experienced a notable increase in the number of deaths by suicide, experiencing 4 deaths by suicide in a 3-month period. This resulted in significant media attention. I'm sure you probably read about it. And obviously it was a very difficult time. A petition was sparked online, and there was much chatter on social media. During the immediate aftermath, we had an outpouring of support from our local community and mental health agencies, with many offers of help and assistance, which was so greatly appreciated and overwhelming at the same time. But I do think it was the community response that truly made unfortunate incidences much more manageable. In the immediate postvention period, we worked collaboratively with several community agencies, most notably our local CMHA, who Meredith is here with us today as well. And they were a significant support and collaborator for us. We already had a good working relationship with them. They had recently begun participating in our mental health advisory committee. We were having conversations about how we might work together. And this all sort of happened and really threw us really right into the thick of it. So they were there immediately to offer their assistance, and given the role that CMHA plays in our community, having their support was pivotal. During that time, they were able to bring some very focused support to assist us during the immediate crisis, including our crisis support during providing on-site drop-in and counseling by their staff that allowed us to free up our staff to sort of deal with the reeling of what was happening on campus. They assisted in the management of contagion and participating in campus events and ad hoc memorials, et cetera, that were happening on campus. They assisted in developing communication strategies, local social media posts, and provided insight and suggestions on how we might move forward. They shared their learnings from other situations that occurred in various communities around us, and helped initiate some contact through our local LIN. Very much a crisis that brought people together, but even more so, the collaboration has continued much past the initial crisis period. We've worked together to provide after hours and weekend support. We have a better communication strategy to manage those with significant mental health concerns who are using multiple community agencies, and we're trying to work together more effectively so that we can provide right service at the right time for students and not duplicate services as well. What else can I say? During our postvention response and in response to the petition that was created, we went forth with a significant student engagement strategy in which we brought in a third-party consultant to help us really engage students in a different way about their experiences around mental health, and that was that information that has helped us inform an action plan for the next 2 to 3 years. We're currently in the process, obviously. It takes lots of time to bring this information together with our mental health framework that was already in existence, and disseminating that information to our community. One of the key learnings from our engagement with students was communication and transparency were very important to them, and highlighting the work that is happening. So in making sure students are informed continues obviously to be an important challenge. So the information that was also we learned through these strategies has been used as a launching point to re-envision our campus mental health services and how we provide services to students. in amongst all this, we're in the middle of integration project, developing a new integrated approach to health and wellness on campus, a construction project that will bring all of these services into one area and provide a one-stop shop for students in close proximity to other wellness types of programs on our campus. So that has been important information to help how we are going to redesign our services once we're all together under one roof. So those are the pieces that I bring to the panel today. Thank you.
So just a few. Great, thank you. And Meredith, we'll get you to wrap up down there.
Great. Good morning, everyone. I'm very honored to be part of today's panel presentation. So as Allison's mentioned, I work for CMHA Ontario. I work for CMHA Waterloo Wellington. And we partnered with CMHA Ontario during the crisis that was happening at the University of Guelph. Our local CMHA is really unique in that we have a number of universities and colleges in our area. So the University of Waterloo is in our catchment area, Wilfrid Laurier, the University of Guelph, and Conestoga College. I've worked at CMHA for 18 years, and we are what we call kind of a cradle-to-grave service. So we have infant and mental health and developmental services. We have children and adolescent services. We also have numerous programs from support to therapeutic and psychiatry programs for adults, as well as a seniors program. So in my portfolio, I have all the gateway services into the service system for mental health and addiction in Waterloo Wellington. So you may have heard of Here 24/7. It was the first integrated system in Ontario where we are the front door for all mental health and addiction services in the Lynn area of Lynn 3 for Waterloo Wellington. So we not only provide that initial intake and assessment for all of those programs, we also do the 24/7 crisis service. So kind of part of what we have prided ourselves on is you can get the same service at 2 o'clock in the afternoon as you can get at 2 o'clock in the morning. And so that's been a really key program in partnering with universities in our area, and in particular in Guelph, and doing some of this crisis management work that we've done. I think not unlike university campuses, we experience significant increase in suicides that are happening in our communities as well. And so part of what we were bringing to our work with the University of Guelph was our experience from our community, but it was also, like I said earlier, partnering with CMHA Ontario and really looking at where else has it happened in our community. So looking at the crisis that happened in Woodstock a number of years ago with the increased number of deaths by suicide in that area as well. CMHA does quality of care reviews, so anytime that we have had a death by suicide in our area, we're reviewing that, and we're reviewing that for learning and improvements and things that we can make changes and gain knowledge about how we can look towards a system of care where we are preventing suicides that are happening in our community. We were also incredibly thankful to have the support of our LIN when the university deaths that happened at Guelph. There was also some deaths at one of our other universities. And our LIN brought us all together and said, whatever you need, you've got. And so I think that is something that I'm always very, very, very thankful that they said, if you need to bring in extra staff, if you need whatever it takes, you have our support to get it done. And so there was some unique problem solving. And in fact, we just had an announcement that our LIN has provided us with some additional resources just to support our campuses and our community to try to do some pilots and look at some innovative and creative ways that we might, again, start to promote positive mental health and reduce the risk of students.
Great, thank you so much. Let's give our panel a round of applause just for that introduction. So as I mentioned, we're going to dive into talking about prevention first, and then move to postvention and collaboration. Before we get started, I just want to kind of confirm that we were right. We told you we have experts around the table, but they also have personal experiences, and they have a lot of personal stories to share about this topic. So thank you so much for your candor already, and I assume that we'll dive even more into that as we get started. Just to touch on why I volunteered to facilitate this panel, as an organization, we represent students in Ontario to the provincial government. So we do a lot of advocacy on the kind of sector-wide investment in mental health and the strategies that students believe should be implemented on our campuses in Ontario. But from personal experience at Western University, where I was the student government president a couple of years ago, we experienced 2 students die as a result of suicide my year. And as a student leader on campus at the time, that kind of situation can be very difficult, given that you are looked to by your students to sometimes provide an answer, to sometimes tell students what you're going to do about that. And so from that little experience, I want to thank Cheyenne specifically for being here to kind of give that student perspective on the panel as a whole. So to dive right in, I'm going to start with the first question, and Cheyenne, we'll start with you and then move down the table again. And that question is, how can we create an environment where mental wellness is discussed openly and both students and staff feel safe to talk about issues related to suicide?
Yeah, so first off, thank you for that. I appreciate being recognized as a student voice, but I hope I do a good job again with it. I think a lot of great things happen on campuses in regarding to mental health supports. And the thing I hear most often though, and the thing that I've seen most often, before I really got involved with mental health, the big thing I think a lot of students know about mental health supports, and honestly, it's kind of shocking that this is the thing that people think of when they think of mental health support, is actually Bell Let's Talk, as like, oh, that's just a mental health thing that happens every year. And a lot of times students, their issue with that is that it's kind of what we kind of call like a checklist kind of thing, where it's a one-off thing that happens once a year, and then it kind of covers you for the rest of the year. It's like, oh, I was involved with this, so no more mental health advocacy for me this year. When in reality, it's something that needs to happen year-round. And I think when we're talking about, wanting to make that culture change, which lets students talk about things more openly, we need to realize that the things we're doing can't just be, one-off events or one-off services. It really needs to be something that's embedded in everything we do throughout the entire year. Whether it's having an event or whether it's campaigns for different kinds of services that are available on campus, it can't just be something where you push it out once, maybe during exams or during those high stress periods. It really does need to be something that is there the entire year, because a lot of times student stress doesn't just occur at certain times throughout the entire year. I mean, speaking from personal experience, I know that for me actually most of my stress has happened in the summer, and so and that's when schools don't really do much anyways because nothing's happening. But with Ryerson, it is a commuter school. People are on campus pretty often anyways. But yeah, so it is really important to make sure that things that we're doing do kind of stretch longer than just these one-off events. It really needs to be something that's pushed throughout the entire year.
Great, thank you. We'll move down to Melinda.
Sure. I have to say, I agree very, very much with, unsurprisingly, we're probably not going to have a lot of dissent across this panel, but I agree with absolutely everything that Cheyenne has just said in terms of the importance of embedding conversations about mental health, embedding conversations about support, resources throughout our work, throughout the campus, throughout as much as what we do as possible. And that includes having conversations with faculty as well about the classroom, having conversations with teaching assistants around the roles that they can play in terms of even just identifying students who may be in difficulty and making an appropriate referral or flagging that student to an office that is able to provide support and care. I think, thinking about that academic cycle, exactly what Cheyenne was talking about, from the moment that a student is admitted, thinking about how we can begin to have those conversations about what are the supports that are available, what is the culture on campus, how can you find support, how can you build community, in all those different facets of when we think about mental health broadly. And then of course for students, we know that there are students who are coming to campus who are already struggling with mental health. They have perhaps a diagnosis, they're coming to campus, and making sure that they're connected with resources as quickly as possible, again from that point of admission, so that they have a care team that can start to be put in place, whether that's accessibility services, counseling services, peer support in terms of mentorship and guidance and those types of things. The other piece, I think, is looking at the campus as a whole and how students, staff, and faculty can play roles and the types of training, I'll use small t, training, support, professional development that can be given to folks. Because in general, in my experience, most people on the campus in most roles want to help. not everyone knows exactly what to do, and not everyone feels comfortable with the same level of help or support, but helping people to engage in the way that they can. So whether that's helping first-year students to learn a little bit about the resources to be able to help a friend, because we know that in often cases, their peers are the people that our students are most likely to go to first, just exactly as Cheyenne was talking about. And then also thinking about frontline staff who may not have a role necessarily officially in mental health on campus, but who are often the folks, whether they're at porter's desks, welcome desks, information desks, the library, who interact with students who may not just show up at our office door to say something, but they can play a role. Our food services staff sometimes, caretaking staff, to be able to flag and support and make referrals when needed. It helps to create a campus environment where everyone is working towards those goals of mental health, wellness, and just community, I would say, which is that foundational piece to creating a healthy campus.
From my perspective, I think it's building on what's already been said on the panel, but also a little bit on what Brenda was saying, where I think we all have responsibility to also model for our students. And so there's a difference between mental health and mental illness. And mental health is something that each one of us has, and each one of us needs to take care of at certain points during the academic year or during our lives. And how we do that creates a healthy campus environment. And so I think that ways in which we engage, to Melinda's point, all different types of staff that are on our campuses, so our caretakers who receive disclosures because they're the ones that the student is constantly bumping into, the personal trainer at the gym who receives a disclosure because they've built up a relationship with that student partner. What we're doing in terms of the recognizing and making appropriate referrals, but how we're also modeling how we take care of our own mental health needs, I think makes a big impact to students. If we can show them that there are blips in our own mental health and there are times in which we need to rely on each other, there are times in which we hurt and struggle too. And then there are times in which we continue to build our resiliency muscle. I think what we're doing is we're creating a healthy campus by design. And I think it has a impact on our students far beyond the academic component or that traditional health component, so that when they go out into the community, they are a reflective adult. They've seen stable and strong adults in their environment while they're getting their undergraduate degree, and they're using the tools that we impart on them through the non-traditional routes as well.
Yeah, absolutely. I'm sure there will be a lot of retweeting what others have said, but yeah, please feel free.
Yeah, not to add anything different from what anyone else on the panel has said, but to offer another perspective about providing training and opportunities for learning about creating safe spaces when we're talking about these issues. So often, people are very well-intentioned, wanting to bring people together to talk about some difficult challenges around own disclosures about mental health issues and suicide, can often draw vulnerable people, and I think we need to have open conversations on our campuses about how to do that in a safe way to ensure the safety of the broader community as well. So I just wanted to add that piece as well.
Thank you. You're good. You're good down there, Meredith. Great. Okay. So we'll move on to our second question then. And so, Meredith, we might start with you this time. So what kind of campus mental health strategies may be introduced to safeguard students who appear to be at high risk for suicide?
I would start by ensuring that people are being asked the question. You do not come for services at CMHA when you're not asked, and maybe you might be asked every single visit, depending on what program you're in, whether you are experiencing any suicidal ideation. So I think we need to have campuses and communities that are comfortable asking the question. There's incredible programs out there like Assist and Mental Health First Aid that are really good at building that skill set, but sometimes you just need to ask the question and ask it really directly. I think that that's a really key component. The other part is really making sure that the counseling services teams or the wellness teams have really good crisis risk assessment skills, that they understand what those static and dynamic risk factors are. So you are getting students at the most at risk, and if you overshoot and you have more identified students than not, well, all the better. But making sure that you really are targeting those most at-risk students and really understanding what the risk factors are. It won't prevent every suicide, but boy, it will prevent a lot.
Thank you.
I think the addition on campuses to having early warning systems in place. So campuses are huge. Students interact with lots of different places. Having an opportunity for students who might be of concern and a way to communicate that so there could be a coordinated response around that, I think is an important piece as well.
Great, thank you. And Andrea, I might pose a little bit of a different question to you then from there. So what sort of early identification strategies can be used to recognize students at high risk for suicide in order to increase the number of on and off campus supports available to them?
I think to Allison's point, the early alert systems are really beneficial. One of the things that we've struggled with at the University of Toronto, by design of how complex it can be and how large it is proper and appropriate communication. And I think when I talk to my other colleagues at different institutions, it's not a unique struggle that we have. I think we're always constantly determining where is the PHIPA line, where is the FIPA line, what can we share, who can we share with, what do they know, and sometimes our core group doesn't actually have all the information they need to be doing their jobs well. And so I think it's an opportunity for institutions to really look at the communication piece as part of the identification strategy, to recognize that you need senior administration involved in that communication piece. You need someone at the vice provost level, the provost level, or within the structure of your university to be at those tables, to know what's going on. And then you need to know what it means to share information appropriately and really dive into that question at those tables before the event happens, so that those that are working know what their roles and responsibilities are, that they complement one another, and that when there are needs identified, you have a holistic team that's able to approach it in a manner that supports one another and the student.
That's great, thank you. And Melinda, I might ask you the same question. And I know we do have various sizes of institutions in the room with us, and so maybe if you could even touch on what that means for a small community like the one that you work for within a large community, that would be great.
For sure. So I think, at University College, we have all of the same kind of issues as we have U of T as a whole in terms of communication. And then there's the communication on the local level that I'm sure we all experience in our departments, in our divisions, in various areas of the campus. And so at the more local level, I think for us that's being very clear in terms of what procedures are, in terms of having our own care team meetings around specific students where we know exactly who is working with that student, and we keep that team updated regularly. And then I think it goes back also to Meredith's point earlier, is having staff, particularly staff and student staff at various levels, trained, and not just trained, but comfortable asking the question and asking it often for some of our students. And so it's training where, in all honesty, the framework that we tend to use is the Living Works framework. So we're using Safe Talk and Assist quite a lot, to the point that it's a verb. And so the students will say, I safe talk this person and they said X, Y, and Z. And we all know exactly what that means, and we're all using the same language. We know what it means when they say they connected them to their KeepSafe connection. We know who that is. And so it does help with the communication. And I know that it's not the program for everyone necessarily, but it creates common language so that we can be clear, whether it's an incident report that comes in from a student staff member, it's a professional staff member who is sharing information, whether it's me sharing information with our principal or the high-risk team in central administration if it's moved up to that level. we're using the same language and it helps with that communication so something doesn't fall through the cracks. So when someone says, oh, I talked to them and I think it's okay, well, what does that mean specifically? And we know. So that's a strategy that has definitely worked well for us.
Great, thank you. Cheyenne, did you want to touch on that?
All I would really say is kind of just echoing the aspect of making sure that it kind of touches on the different levels. So, not only making sure that staff know kind of what things to look out for, but students as well, because I think that student groups are something that a lot of students spend a lot of time in, student clubs, student activities. So, there might be a time where, even during reading week, where you're not going to class, but you're still on campus interacting with people. So really making sure that that kind of knowledge goes past just staff and faculty, I think is really important, just so that we can all kind of be looking out for that, since most of the time when you're in class, really, you're only focused on writing down as fast as you can what the prof is saying on the lecture, and so you're not really too focused on talking to someone, but afterwards you might open up during, volleyball practice or something, so you need to kind of have that knowledge across the board.
Great, thank you so much. Was there any other comments? Yeah.
I think this is also a really amazing opportunity of where you're connecting with your community organizations. Because when crises happen, not only between Monday to Friday, 9 to 5, they happen in the evenings, they happen in the weekends, and there's your opportunity to build that relationship with your community organizations, work on a joint strategy about how you might support students in a 24/7 approach, and how do you share that information, and what's the flow of communication back and forth between the community and back onto the campus. I think that that's another really important piece and an opportunity.
Thank you. Great. Anyone want to jump in at this point? Sure.
I didn't expect a mic. Okay. Yeah. Hello, everyone. Something that I think is also important to keep in mind is we always talk about like why students don't, come forward with thoughts of suicide, why they wouldn't disclose. And I know a lot of people who have counselors, therapists, psychotherapists, psychologists, whatever, and they tell me about their thoughts of suicide, but then they're like, well, I haven't told my therapist. And I'm like, why? And I think a big part of that is fear of what's going to happen after. And I think something that can actually be really helpful, and this is all in theory, I have no evidence, but I think it would be helpful to just somewhere make it very explicitly clear to students that like, if you disclose suicide, these are the things that will happen. These are the ways in which we'll support you, and these are the things that won't happen. Like, we're not gonna just throw you into, we're not gonna just kick you out of school. We're not gonna kick you out of residence. We're not gonna do this, that, and the other. Because I think we, like faculty level, like administrative level, like we do a lot of talk about like what would happen. Like we discuss, profs wanna know what'll happen. Like everyone wants to know what'll happen, and there are a lot of protocols and policies that are written. And so just kind of, letting students know that those discussions are taking place and letting students know, hey, if you come forward, it's not the end of the world. We're not gonna shut you out. We're not gonna take away your autonomy and your freedom and think you're like crazy or something like that, right? Like letting them know, recognizing that they're rational and that they can like process information and that they would appreciate that, I think is important.
Great, thank you for adding that on. With that, I have a question about readmitting a student with a previous suicide attempt. And so I'm going to pass this to Cheyenne to kind of speak on the student point of view, and then over to Andrea on a more policy perspective. But what procedures should be followed when readmitting a student with a previous suicide attempt after a leave from school so that students feel safe and welcome?
For sure. So obviously, well, not obviously, but I can't speak too much to the procedure aspect in terms of policies, but things that I've seen that just work when students kind of go through these different periods of time and then kind of want to get back into the groove of things is kind of echoing what was said, which is really not making them feel like they're a part of a different group now just because they've kind of went through something. So, I think it was echoed before where, it was touched on how, not everyone has mental illness, but we all have mental health. And I think that's the really big thing that a lot of students don't recognize when it comes to these different things. So when they struggle with something, they just really automatically think that they're part of this, them group, and then everyone else is totally normal. When in reality, we all know that everyone can struggle at different times, and that's the thing I think that really needs to be highlighted when that student is coming back. I know something that happened in one of the student groups I was a part of, actually, where it wasn't a suicide attempt or anything like that, but the student was struggling a lot and kind of withdrew from that group, and just didn't really attend any of our meetings, wasn't really responding. And then when that student kind of got back and talked to us, we realized that they were going through something. And rather than kind of bring them back in and make it a very awkward thing, we just wanted to kind of integrate it as normally as possible. So we just held a meeting, but it wasn't a meeting regarding anything about the student group. It was just kind of like a hangout meeting, just a very normal, relaxed kind of meeting. And part of this meeting, we just kind of went around and just asked people, how they were doing. And it wasn't, again, in front of everyone where everyone's sitting in a circle, or anything like that. It was just kind of like a check-in thing where, how's your dog? How's your family? How's all that stuff going? And through this, it kind of made a much more normal environment for students to open up and disclose about things. So that student that was struggling through that realized that, they're not the only one that was kind of, stressed out, whether it was about exams or anything like that. So really just trying to make that person not feel like they're part of this other group, I think, is the most important thing that can be done. And that also echoes off what was said where, outlining just because you disclose something doesn't mean we're gonna, send you out of residence or anything like that.
Great, thank you. Andrew, I'll pass it to you.
So I think it's important to recognize the reality that there's procedures, policies, and then there's practice. And sometimes they don't all go together. I think that you can have policies and procedures around readmitting a student that looks at protection of their academic record, because ultimately that's why they're coming to university. So we want to make sure that that's protected and that it's safe and that they can continue to be successful while they're on our campuses. Procedures and policies that look at what treatments might be in place for the student to support them coming back so that they have control of their mental illness or their mental health needs, what we're doing internally to support those teams, how we're communicating with our external agencies, or if we have permission to speak with the medical teams that might be supporting the student as well. But then I think in practice, to the earlier points, is how do we actually support the student coming back? And one of the things sometimes we tend to miss is the conversation with the student who's coming back and asking them what they want that to look like. And so finding your internal care team where you have one or two caseworkers that maybe have a previous relationship with the student that can start to build that before the student pops up back in residence or on the radar in class, so that they have a support team internally, that they're able to talk to deans of students and residence dons about what it looks like if they're coming back into a residence environment, and that there's enough support, but then there's also enough protection of their privacy and the information that they want to share. Because some students might be willing to share more information, some students might share more information than you want them to share, and then other students don't want to talk about it at all. And so respecting that continuum, I think, comes from the place of, if any of us were struggling with a health issue and return to work, what would we want that to look like in that environment? And I think that when you can approach it from that standpoint, you also support the student in various ways as well.
Thank you. I'll open it up to the rest of the panel for any comments on this one in particular. No? Oh,
Make
yes,
just a brief
sure.
comment. I guess. Okay.
Melinda,
make a
I'll
very
let you,
quick comment,
yeah, I'll
and
let you
while
comment
run with the
first,
mic,
and then we'll go to the question.
Just to say that I very much agree, and I think that there's a very strong connection between the way that we reintegrate students into, whether that's the campus environment as a whole, into a residence environment, and with the point, the really, really important point that you made about concerns about the what's going to happen question, because I think probably many of us have either faced that with a student who is not comfortable disclosing for that reason, or have been critiqued for the way that institutions perhaps have responded, or concerns about the ways that we might respond. I think the reality is that the vast majority of students who do have mental health concerns, who do have suicidal ideation, or who do make suicide attempts, return to campus, return to residence, in fact. And the way that we help those students to reintegrate and the supports that we give is probably the best promotion that we can do to reduce some of that fear and some of that stigma that may be associated for the student who does have the concern of what will happen. Because sometimes there are very public concerns raised about about some unique situations that don't necessarily tell the story of what's happening in the for the vast majority of students.
Thank you, that's great. We'll go to our question.
It's a comment more as a mental health nurse who's been working frontline for many, many years. One thing that I've come to appreciate is that, well, I think what we're talking about here is judgment. The students are afraid of being judged harshly for having considered suicide as a reasonable alternative to deal with their struggles, that it's a weakness to turn to that. But as a clinician, I recognize that thoughts of suicide is actually a symptom of depression. And so I try to reassure them that I'm not going to judge them. I'm recognizing that their depression is quite severe if that's where their thoughts are at, is with considering that suicide is a good option. So it's that reassurance that the academics are not going to find out, and these people are not going to find out about the fear of return, but also just reassuring them about that as a clinician, at least. There's no judgment involved. We're treating it as a symptom.
Great, thank you for that comment. Any other questions before we move on to speaking about postvention? Sure, at the back, we'll get you a mic. Right over here, unless you want to yell.
I'm a counselor at a college, and we send these students to emerge, and they come back very quickly. And can we partner somehow where the counselors go along with them and with the students' permission to talk about what's brought them there, et cetera, et cetera. But over many years, this just keeps going round and round.
Yeah, so the question for anyone who couldn't hear it, yep. You're right ahead of me. The question for anyone who couldn't hear it was partnerships on campus with counselors or with staff on campus with emergency departments, and how what that process looks like for a student, and how we can, I guess, work to prevent the cyclical nature of that kind of back and forth. Sure, I'll let you get started with that.
So I can tell you at the University of Guelph, we've worked for many years with our emergency department in terms of trying to develop those relationships, especially in the after hours, when students are going to emerge in the after hours and there isn't that immediate support on campus when they return. And we've had some success in terms of, with obviously the students' permission, working with our resident staff when they're coming back to residence in particular, ensuring that there is someone to greet them when they return and that reintegration. We also introduced our mental health care coordinator position who liaisons with the hospital emergency rooms, and we receive with fair regularity emergency reports of students who have come to the emerge that we could then follow up with them. More recently, though, in terms of, and probably our emerge department is quite happy to hear about this, doing some work to try to prevent those students, particularly in residence, although for the entire campus, from going to emerge at all. Often students are working with residence life staff who have a certain limited of scope of a way they can support a student who might be feeling at risk. So in working with our CMHA and their distress team, we now have a relationship in which they will come to our campus or at least provide a on the telephone assessment of that individual from a safety perspective and a risk perspective, and then working with our team in terms of communication and follow-up with that person. So can really do some more significant work over the phone or in person without having to go to emerge and developing safety plans, et cetera. And that we've just sort of implemented that this year. So we're piloting that. I don't know if you want to add anything else to that.
I mean, it's not just a campus problem. It happens everywhere in the community. And I think where we have done some work at CMHA and Waterloo Wellington is really partnering with the hospitals to look at what's the difference between a crisis, an urgent situation, and a psychiatric emergency. And so really focusing on sending community people, residents of our community, whether they're students or not, to hospital when they're in the midst of a psychiatric emergency, and really partnering with community organizations to deal with urgent and crisis situations, and really being clear about what the difference is, the mental health system, for the 18 years I've been part of it, has always described mental health issues in the terms of mild, moderate to severe. The problem with that is it's so incredibly subjective. It's based on the people you have in front of you. So if you're a hospital and you have 10 beds and you have someone who's experiencing psychosis, you have somebody who is manic, you're having somebody, whatever the gamut may be, you really need to look at how do you best prioritize those beds and who's the best people to have in there, right? And so again, it's that right service at the right time, and sending people to emerge maybe not necessarily the best alternative. And so I really would encourage that, that's the one benefit of doing that. The other piece is really, like I say, go back to that crisis assessment and risk piece. Really having people on campus or you're working within the community and partnering who have that skill set to be able to differentiate those people. From a community perspective, one of the things we've been looking at is the number of police calls, for example, that are involved in the amount of policing time. It's been a big, big issue in our community, and it's a big issue across the province. And so one of the big learning pieces, we've actually embedded mental health staff right in with the policing departments. So when they go on a mental health call, they bring the team with them. So there's COAST programs, and we call ours Impact. There's differing programs across the province. We have had a dramatic drop in the amount of policing time in our communities spent at Emerge, bringing people there that don't need to be there, and it's really, we're working very hard to stop that revolving door. So I think that's really those partnerships and those linking, and really getting clear about what the difference is between an urgent crisis and a psychiatric emergency.
We've also tried to develop strong partnerships with our hospitals, but I can admit that it's been a challenge. And I think it's a challenge in part where when the discharge planning is put in place and there's the expectation that the university might be able to do more than they actually can. And so educating the emergency room physicians and nurses and staff to know exactly what universities can and can't do from a health perspective, I think is critical. And then I also think that there's those internal partners that you might forget about because, as Allison pointed out, they do happen after hours more often than not. So what we've done is worked very closely with our campus police partners, or on other campuses, might be campus security, to be informed first thing when a mental health apprehension has occurred or a transport to the hospital has occurred, so that we can start to track that student and have our crisis team start to engage and track the student. Because quite honestly, sometimes our students go to the hospital and we don't know that they've gone to the hospital, and then they come back, and it's not until somebody else has had a conversation with them that we're discovering all of this has happened. And so that internal communication piece is critical, but one of our challenges has really been in educating our hospital partners on what we can and can't do from a short-term perspective and a long-term perspective.
Thank you. Any other comments from the panel? No? Okay, great. We'll move on to speaking about postvention now. And so the first question, and I guess it's a quite large one, and Cheyenne, we'll start with you. What should the main goal of suicide postvention efforts be?
So I think that with things like this, there's obviously a lot kind of on the table to handle, especially in kind of smaller campuses, but really any campus when something like this happens. I know Ryerson, we had an incident 2 years ago, and Ryerson's a decently big school, about I think 40,000 students, but people who didn't even know this individual were still really affected by it. And so I think one thing that's really important is to not try to cover anything of what happened. Obviously, while keeping in mind the different procedures and stuff that have been put in place about what information you can disclose, because you don't want to do anything triggering, but it is important for students to know what happened and kind of what took place, but in a way where they realize that these things are kind of something that we all need to be looking out for. It's not just something where it's, again, that isolated group of individuals. This is something where all of us need to kind of be aware of, not only for ourselves, but for those around us as well. I know that, again, when this happened, there was a lot of students who kind of kept saying things like, you know, like, oh, I would have never thought that it would have happened to this person, or like, oh, they seem so normal, you know, nothing was wrong or anything like that. So it is really important to kind of make sure that it's a whole campus kind of action that takes place, so that everyone's really getting involved. So if this student, for example, was an art student, making sure that the engineering students maybe have some kinds of events relating to mental health following this, and really making sure where it's, again, a full campus thing. But I also think one thing that's really important is allowing students that time to heal. Kind of having that balance between actions we need to take regarding kind of creating the awareness around this, but also just giving students some time and maybe even the spaces to just, understand what happened and just kind of be able to, appreciate one another. I know one event that actually took place, it was probably about a week and a half after the suicide took place on campus, where it was just kind of like it was in one of our event spaces on campus where it was just about remembering that student. And so I know for that it was really helpful for the students who knew her, because they all just kind of got to remember the best moments, but also talk kind of candidly to one another, and kind of seeing each other there, all of us being vulnerable, really did help in the sense of kind of realizing we all need to take a part in taking care of one another. And I think that's a part that it's not just the university that needs to be watching out for these things. Really, it is a full campus-led kind of initiative that needs to take place. So yeah, just really making sure that there is that time to heal, but also that there is awareness around this, and especially from the aspect of this is something that we all need to be taking a priority in, and really making sure that everyone kind of gets involved at the different stages.
Great, thank you. We'll pass it over to you, Melinda. And before you get going, just because Cheyenne brought this up a little bit in his comments, what is also the most supportive way to disclose information surrounding a suicide on campus to staff and students after it's happened?
Yeah. So, I mean, I think that I would agree with much of what Cheyenne said in terms of those critical pieces around facilitating the grieving process, allowing students, staff, and faculty to have a time to grieve, to process what's happened, and to stabilize the campus environment and help folks get their feet back under them and return to a routine. I think the issue of communication with the campus is definitely a challenging one, and I think that different campuses have different approaches, and sometimes different circumstances require adjustments to those approaches. I would say in our context at U of T, it has not necessarily been our practice to communicate with the entire campus, and part of the rationale for that is because of the size of the campus and the size of the varying communities. And so, while it has been our practice in the case of University College to communicate with the entirety of University College and then any other campus communities that we're aware that the student would be a part of the question is around the degree to which our communication strategy helps to facilitate a healing process and communication, and ensuring that we don't cross a boundary into institutionalizing the grieving process or violating the confidentiality of that student or their family, depending on what the family wishes are and can be, because that's a really critical component of any postvention process, is connecting with that student's family, understanding what the wishes of that family are, and different families are going to feel differently about how broadly they would like the information shared and how detailed they would like the information to be. And so just being very cognizant of that, I think that some of our approaches have been to identify essentially circles of contact with that student and thinking about how we would share that information. So for example, students that lived on a house or in a floor with that student or a part of an organization, to share that information in person, to share it with them honestly, openly, and also have supports available when we're sharing that information with them. For broader folks, it's also about ensuring that information is shared in a timely manner, and so sometimes that does mean email messages or posted messages to a campus, but again, with a clear understanding that there's a high probability we won't have caught every single student who has known this person and connected, so that we are very clear about how someone can reach out, where there's support available, and how we are available to support them. I think it's important that we're honest, but it's also important that we manage the detail of the information that we're sharing. Again, because part of that postvention process is that we want to also be limiting any future risk. And extreme detail is not helpful. In fact, in some cases, it can actually be harmful. And so we want to be cautious. I think my approach has always also been to consult with some of our clinical staff as well, with any information that we're sending out, to make sure that everything that we're doing is designed to help move us forward, to help move us through this process, and to help meet those postvention goals that we've set forth.
That's great. Yeah, so I'm hearing a few things about, the method, the timeline, and the actual content of that message. I'll open it up to the rest of the panel to comment if there's anything else we wanted to cover. No? Okay. Great. I'm seeing a couple of hands. I'll go to you for a question first.
Just for recording? Oh, for recording? Oh, okay.
Yeah, and I was just going to say quickly, I'm watching the clock, and we were ahead of schedule yesterday, so we're going to try not throw off the schedule for today, which I'm sure both of you appreciate. So we'll go to your question, and then we'll move on to talking about collaboration.
My question will be very quick to ask anyway. Have any of you conducted or would consider conducting a secular memorial service in the case of suicide, inviting all of the friends and contacts of that individual to come and speak their feelings and thoughts about that individual and the loss of that individual? Thank you.
Great, thank you so much. Does anyone want to take this one? Yeah?
We've had much discussion on our campus with regards to memorials around after a death by suicide. And we have a student death protocol, and we've really taken the lead of students who know that student and whether they want to come together as a group as opposed to hosting it as a university perspective. There is a body of knowledge and information out there about best practices around memorials, and we've done some further sort of discussion and talking about the best approach on that. Speaking to Melinda's earlier point around wanting to provide people opportunity to grieve, but also not wanting to create further the contagion effect, et cetera, and those vulnerable students. So it is very much a delicate balance, and I think it's something that we've had significant conversations about with, and still in each situation sort of balance that fine line. I don't know, do you want to?
I think you've got to tread carefully. I think that the contagion effect is significant. There's, you don't want to, it's a difficult situation to be in because I don't know that kind of maybe politically you want to be vetting what people are going to say, but you also from a responsibility perspective want to be knowing what people are going to be sharing, what the level of it is, and how to contain that when people are in a heightened emotional state and start sharing beyond what's probably appropriate in that setting. And so I think those are the things from a best practice perspective you really want to have a handle on. So I think there's a way to do it, but you need to be really careful. The other thing to be careful about is even where it's located, where you're having it. What was one of the big learnings from Woodstock was they talked about that one of the students had died, and one of the local schools had offered up the opportunity to have the funeral at the school. Well, no, you don't want students in those situations. So there's so many really things to really think about from a contagion perspective, timing of how far after, and how raw things are for people, beyond what family wishes are as well.
Did anyone else want to comment on this one? Yeah, Cheyenne.
Yeah, just kind of really echoing what was said, but something I think is really important too is kind of the whole aspect of letting the students, supporting the students if they want to kind of lead something like this. I think one thing that's really important is obviously the students will want to kind of run something like this in order to, support one another. But I think, even the smallest things of connecting them to counselors so that they can kind of, whether the counselors want to actually be there at the event, but also in regards to planning and kind of speaking to the students. I think there's a lot of resources within the school that can be provided to the students instead of actually having the school run the event itself. So really just being open to the students about saying this is what we can kind of provide you for this, whether it is the smallest thing of providing an actual space for the event, if that's a possibility or anything, but again, connecting them to the resources that exist on campus and off campus that they might not have access to themselves without the support of the school.
Yeah, that's great, and I think it's really interesting, your discussion about some of the challenges that do exist and making sure that whether it's the help that can be provided to students or whether it's explaining those barriers and challenges, that can help create a more community amongst the stakeholders that are involved on campus. That's great. I'm going to send it back down to Allison and Meredith just quickly to talk about the kind of the close community and campus relationship you've formed. And I know you talked about it a little bit in your introductions, but I was also hoping if you could touch on some of the successful external messaging development after a suicide has happened on campus.
So Allison and I spent a lot of time together last year, and we still spend quite a bit of time together this year. I think the messaging piece was something that we really were very thankful and appreciative and learned a lot from CMHA Ontario, and really looking at how when you're asked questions that are difficult, even the media that started at the beginning of this school year in September, just really focusing on positive messages, working with your community partners. So we were working with community partners who weren't necessarily directly involved, but just using this as an opportunity when reporters are looking for information or wanting to do that kind of reach out, that you can, you've got everybody on the same page, you've got key talking and speaking notes, you've got key messages that you want to have out, and so we were really kind of connecting and communicating on a weekly basis during the heightened time period for sure. I think that, Allison and I have talked about that having that existing relationship was really, really important, so that we were able to, to move in. I think the other part from a community organization, and I don't think that this is likely unique to Guelph, and it may be something, but I think often community organizations look at it as if you universities have brought these students into our communities, and so therefore you shall take care of them. And so we really took the place at CMHA of saying, we don't ask people who live in our community, are you planning on staying here for a short time or a long time? You're a resident in our community and we're going to support and serve you. And, I think, I was saying to Allison on the train in this morning that it's kind of that analogy, you say is if your neighbor's house is on fire, you don't stop and say, I'm not really into fire. I don't have really any firefighting skills, right? You give whatever you can at that moment in time to support. And I think, when we haven't kind of talked about this so much in the panel, but I think it's also really caring for the staff that are in the midst of all of this. And so, when we would have time periods where we would meet with the counseling staff, that you're in the position of supporting a whole university campus, you have had a significant loss that you feel intuitively. And then, sometimes you may be being criticized for the services you're providing or the wait list that exists. And so I think it's really around wrapping around a crisis, regardless of what that crisis is, whether it's one death by suicide or multiple or any other tragic event that could happen on a campus. And I think it's about building those partnerships and those linkages and bringing everybody in to fight the fire together.
Thank you.
I would just add to that as well, the approach and the communication by bringing the community together, the various community agencies really spoke to everyone else that it wasn't a University of Guelph issue, it was a community issue. And I think that was very important from both the students on campus, but also the staff on campus, because it felt very much at the time a University of Guelph issue. I think that was one of the added benefits of making that very clear as we were going through the process and as we, the social media criticism, et cetera, was happening. So I think that community partnership there was key. I don't think I have anything else to add beyond what Meredith's already talked about or we've already talked about. But again, the recognition of the university being part of a broader community, not sort of its own private little silo, I think was an important I think we already knew that, but we actually began to work in that way. So a lot of positive things have come out of some very unfortunate events, and I think in a good position for moving forward.
Thank you. Is there anything else from the panel before we open up to questions? Great. Brenda, you're right here in front of me. We'll get you a mic.
She's very keen. Yeah, maybe I could just add to, the previous year we had 3 student deaths quickly, but they were accidents. 2 students died in a kayak accident and 1 died in a car accident. Lots of grief and healing that was necessary. The difference with the suicides was we had the added piece of blame. So when it's a suicide, it's not just about healing, it's about anger and thinking that, well, that one could have been somehow corrected by the university. And so I really want to emphasize so much help CMHA Ontario in terms of that messaging, because you get into that protective kind of, I was like a mama bear, right? And you can't be in that protective mode at that time. So that was very helpful in that constant messaging, and then also having it being able to say every time the TV was on, getting calls from the media, you might also want to talk to CMHA, you might also want to talk to, because I think that really helped us, the staff. So again, really watching out for your staff as well, because we really struggled.
Thank you so much. Is there another question? Sure.
Not so much a question, but just something that I kind of wanted to bring up. I think I think Cheyenne and a few others alluded to the fact that this affects everyone in the community, whether they directly knew the person who died by suicide or not. And I feel like just from when I was a student recently, in my first year, I believe there was someone who died by suicide at the McMaster campus, and I remember never having heard of the student's name until he died by suicide. And I remember thinking, I don't know this person, but I'm very deeply upset that this has happened. And I find that a lot of my friends and myself, we self-invalidated our feelings of distress at the loss of this person, because we're like, we don't even know them. This person has family and friends who have a right to be upset. Why am I upset? I don't even know this person. So I think another part of messaging that could be really helpful for students is not so much direct one-on-one, but just on a broader public messaging that the university is putting out, just kind of acknowledging that it's understandable and okay to be affected by this, even if you didn't know this person, for students, faculty, and staff, and just saying that it's important to acknowledge your feelings and get support for them, and then provide some resources and stuff. I think that has been helpful in my experience.
Great, thank you. One more question, and then we're gonna try and wrap things up.
Hey, thank you so much for this panel. One challenge that I face at my school is, different departmental stakeholders have different priorities, and one really big one that comes up again and again with any sort of mental health stuff is the prospective student versus current student divide. So people who are working in my department in student affairs, it's all about healing and this kind of thing, and then the marketing department is more about reputation management, right? How do we make sure that this school isn't the school that drives people to suicide, even though we know that talking openly about these things doesn't mean that it's, or not talking openly about it doesn't mean it's not happening. We're just sweeping it under the rug otherwise. I'm just wondering if anybody can kind of speak to engagements, finding middle ground, how you kind of manage that difference of opinion.
I think that's where your community partner becomes really helpful, right? Because then we're speaking to it. And we can be talking about suicide, we can be talking about information, we can be talking about resources, we can be, adding an empathy, but also adding a positive messaging around that. And so I think sometimes you get the answer to some of those pieces without having to be the person making those choices. So it can divert some of that messaging away from the business of campuses.
Great. Anyone else from the panel want to comment?
I would say also that, I think there's a balance, and so there's when we're speaking openly about suicides that have occurred on campus, there is a reputational impact to that, which is unfortunate. But when we're talking about mental health and supports for mental health, I think some of the conversations that we have had is around the degree to which that actually is potentially beneficial to the recruitment process, particularly for an institution that, I don't think I'm speaking out of turn, that does not necessarily always have the reputation for being the warmest and fuzziest institution. And so to be upfront about the fact that we're attempting to support students, that there are supports on campus, has the flip side of that coin is that it's actually beneficial and sends a message that we actually do care about this. And for the students that we know are considering which institution to go to, and they have previous histories of mental health. It doesn't start the day that they arrive on our campus. This is something that many of our students have been dealing with throughout high school, throughout their lives, with their family, etc. That it's at least us sending a message from the very beginning that says there are supports in place that will hopefully connect into some of these prevention measures that we've been talking about today, so that it's something that's on the radar from the beginning. But it is a difficult balance, because definitely as like student affairs folks are often coming with a very different lens than recruitment or advancement would be the other folks that sometimes are seeing things through a slightly different lens as well.
Great, thank you. I think it's a cliche to say, but this conversation could probably go on well through lunch. Just to recognize Andrea and Cheyenne, who didn't get to comment on that last question. Before we wrap up, if you could both maybe share just a 30-second, I guess, closing statement to cover anything that you didn't get a chance to talk about, and we'll wrap up after that.
Yeah, so I hope it doesn't sound too segmented, but just a few thoughts that popped in my head as people were talking is, one is that students will always kind of gossip and talk about things that are going on campus. So I think that, kind of echoing what was said, I think it is a really great opportunity, whether it's collaborating with another organization or you know, in your marketing, to take that kind of lead to set the tone, because I think, from my experience at least, when there isn't that kind of information being given, regardless of what level of information that is, I find that students will oftentimes create their own dialogue, which can often be a much worse one than what it actually is in reality. So it is important to kind of take that step. Another really quick thing just about collaboration is I think it is really important, whether it's collaborating with students or collaborating with other organizations, that it's not a quote unquote like tokenistic collaboration where you just bring that organization in because you Googled youth mental health and it was like the first thing that popped up. You want it to be something where it actually does bring a value to your students, whether it represents the diversity of the students on campus or the size or what students are kind of using. So if a lot of students on campus are really interested in this organization called jack.org and you know they're talking about it, then bringing them in might be a good idea. Or if it's another organization, whatever it is, kind of getting what would be best for your students, not just what kind of fits the mark the best to the checklist side of things.
That's a good example, Cheyenne.
I think I would just end with the fact that this is really difficult work, and looking around the room and knowing the professionals that are sitting in this room, you need to acknowledge that to yourselves and to your colleagues, and we need to find ways in which we can make the work less difficult. I think we tend to sometimes challenge each other in these times. I think that there are always opportunities for us to learn from these incidents, but to critique and to become something other than a colleague that recognizes that a lot of this is really but for luck, that many of our institutions are not experiencing this. And I think that when we look at it through the lens of hindsight, which is a beautiful, wonderful place to sit, you have to recognize that you're sitting in the chair that others now need to relate to, and ways in which you can build partnerships in tragedy is critical, and recognizing that everyone does their best effort in the worst circumstances. And so, yes, there are ways in which you can improve and there are learnings to be had, but to acknowledge and to celebrate the hard work that each one of us undertakes, I think is critical to continuing this dialogue and continuing to change the way in which our institutions approach these issues.
I think there's no greater closing than that, so thank you all so much for your participation today. One thing I might do is volunteer all of you for some chats over coffee or lunch as the day goes on, just to continue talking, because I know there were some questions and comments we didn't get to. So thank you so much.
Thank you, Sophie, and thank you to everyone on the panel for being part of this conversation and being in the proverbial spotlight as we're talking about this. It is a difficult conversation, and talking about student suicide is challenging not only for the students affected, obviously, but for all of those who work closely with students and care deeply about their well-being. So we are going into a break right now, and I also wanted to let everyone know that we have a wellness room set aside. It is the Lee side room. So if you feel like you would like just some quiet space to practice some self-care, please feel free to use the room. And if you would like to talk to anyone, just debrief something, please feel free to approach any of the staff at the center. I hope that all of you here today were able to take away something useful from this discussion to support the great work that you do at your institutions. CICMH also hosted a roundtable discussion on suicide prevention in September, which some of you may have taken part in, where we shared many resources and guides that are available to us. All of these resources are now also accessible on our website, campusmentalhealth.ca. There are guides pertinent to drafting campus crisis management policy, suicide protocols, postvention messaging, and more. So please look them up on our website if you feel like these will be useful to you. We will continue to hold these roundtable discussions, which we hope that as many of you as possible would be able to participate in. And thank you once again to everyone in attendance today who came here and took part in this important conversation on supporting students.